Hi, I'm Dr. Greg Apsey here in Warren, Michigan. I'd like to speak with you today about something that happens on a fairly regular basis. It's called cracked tooth syndrome. And we, we call it a syndrome because it's something that's sometimes not real obvious, not that easy to detect. Um, it generally presents as a toothache that comes and goes. Usually when a person is eating, chewing their food, they're noticing an ache as they chew the food. Maybe it's hurting after the meal, maybe it's not even hurting during the meal. Um, it's often caused by heavy clenching of the teeth. A lot of people have this problem where they, either while driving or while working, or while sleeping. A lot of times while sleeping, they will put their teeth together and just squeeze very firmly. And what we find is at nighttime, those forces can be tremendous. And so a perfectly good molar tooth can be split in half. So I want to show you a picture here of a patient who I saw just today. And we went in to do a routine filling. This was an area where there was some decay and we had cleaned out the decay. But he had been complaining of some discomfort and there was a little minor decay in here. We cleaned that out and we were getting ready to fill this. Now, but as I was cleaning this tooth out, my light was hitting this tooth in just the right way, and I could see, you can see this dark line down the middle of this tooth. And the last time I saw him, this just looked like normal anatomy. But in reality, this right here is where the tooth is fractured. And so what we ended up doing in this case was we're going to be putting a crown on the tooth to hold the tooth together. The problem is that it's very difficult to diagnose how deep into the structure this fracture goes. What we want to do when a tooth begins to fracture is we want to catch it early. We want to treat it before that fracture is deep enough that it's into the nerve or really doing some major damage to the tooth. So right now this patient is in a temporary crown, and what a crown does is it encircles the tooth, holds the tooth together with right now it's a temporary, so it's plastic, but it will be porcelain or gold. And what it does is it holds the tooth together and prevents it from splitting completely apart. So we're testing this out with him. He's got the temporary crown in, and we're going to see how he does. But there is a fairly good chance that little crack in this otherwise perfect tooth may be so deep that the tooth has to be extracted. So if you notice that you're having discomfort on biting pressure or discomfort during meals, you've got to get that checked out. There's a good chance you've got cracked tooth syndrome. Thanks for listening. Have a good day.